Welcome back, everyone. Dr. Ashley here, and this week's topic of conversation is lateral hip pain. How many of you out there have ever experienced pain right on the outside of your hip? It bothers you when you sit, it bothers you when you walk or run, and maybe even when you're sleeping. So there's 3 things that I want to tackle throughout the duration of this video. The first is, why does this discomfort happen? The second is, what are some things that you can modify in your daily schedule to help make a difference with the discomfort? And 3, I want to give you some exercises to start doing to help strengthen that area to hopefully help you get rid of your pain. So why does this lateral hip pain happen? Oftentimes, people come into the clinic and they say to me, oh, I think I have bursitis, or oh, I've been diagnosed with bursitis, greater trochanteric pain syndrome, or something of the sort. What research has actually found throughout the years is pain in this area tends to be multi-factorial. It doesn't just have to do with inflammation of a bursa. It actually sometimes has to do with the muscle and tendon structures around that hip or that attach right in that area where that bursa sits, more than the actual inflammation of the bursa itself. So we need to start discussing this in regards to activity modification, and we need to think about it as getting stronger to really help this area heal. If we simply just sit around and don't do anything, yes, it might feel better until you start to ramp up your activity again. A lot of the time, these injuries do occur due to repetitive stress. So something that you're doing repeatedly, whether it even just simply be crossing your legs too often. If you're running with too narrow of a stride, sometimes what we see is a little bit of irritation in this area. And from personal experience, I can tell you that if you are a weightlifter, you can also experience some discomfort on that outside of the hip simply from knee drive and simply from trying to get yourself out of the bottom of a weighted squat. So there's a lot of reasons as to why this discomfort pops up over time. However, more likely than not, it's not simply due to solely an inflammation, but you have to look at the muscle and tendon structures around that area as well. Before I move on to the modifications of activities that you do on a daily basis, I did want to show you just a simple picture in regards to where the bursa sits as well as all of the muscles. So here we go. What you see here is a picture of the hip, and what you see, and I'm not having all of the muscles that attach in this area be visible currently. What I'm actually going to show you right now is simply the bursa, right? The IT band region, which can put a little bit of compression in that area, as well as the gluteus minimus and the gluteus medius. 2 muscles and tendinous structures that actually play a big part in the compression of that region where we end up with this nagging hip pain. So let's move on to modifications. But before I do, make sure that you hit that subscribe button. And if you're enjoying our content, share the channel with your friends. All right, so here's a list of simple modifications that you can do during daily activity to help yourself with this discomfort. The first thing that I always advise my clients is stop sitting with your legs crossed, even your ankles crossed. The reason being is one of the main factors of continued pain in that lateral hip area is compression on the structures. Think, I'm just taking something and pulling it, or say I'm taking something and pulling it that attaches over something right in this area. If I pull, we just continue to put compression, which makes that area irritated. Now, the next thing that I tell people is actually make sure when you're sleeping, avoid sleeping on that painful side if you can, but also remember to do something such as put a pillow in between your knees. The reason being is this helps decrease what we call the hip abduction moment, or the moment where our knees are moving together, which also helps to decrease the pain in that area. Now, before I go on to the next one, I know a lot of you are currently thinking, well, what about anti-inflammatories and what about icing? Well, you can use those 2 things. I don't always recommend to use them in the long term. However, believe it or not, research shows that they don't do as much for us in regards to inflammation and decreasing chronic pain as we once thought. You can do it to decrease kind of that acute pain that you have, which is just fine. However, over the long run, it may not do too much. The next thing that I discuss with people is make sure that you're avoiding discomfort that is greater than a 4. When we are working through this discomfort on the lateral hip, remember, it's not always just due to some sort of inflammation of a bursa. A lot of the times we see tendon problems, so tendinitis, tendinopathy in that region of the lateral hip, or we see small tears in the muscle strains, right, that have occurred over time. We want to make sure that you are doing your best to heal the structures to help the hip stay strong, especially to continue to do what you love. So remember, pain 0 to 4 out of 10 is okay to work through. Next up, what we're going to get into is how you should modify the way you walk or the way you run when it actually comes to dealing with this discomfort. What I often say is when people walk or run, we actually just need to think about widening our stance a little bit. Think that you are walking on both sides of a white line. So your foot, as you walk, they're staying a little bit more apart than they are together. A lot of people don't realize that the repetitive stress of walking or the repetitive stress of running, especially if you're running with too narrow of a gait pattern, you can actually have some of this stuff, such as a gluteus medius tendinitis or tendinopathy, or that little bit of bursitis pop up over time. This is often something that we also prescribe for people who are dealing with IT band issues. Why? Because you get to decrease the compression of that region. And remember, when we're dealing with this lateral hip pain, decreasing the compression where those tendons and where that bursa is extremely important. And last but not least in this area of modifications of things that you can do on a daily basis is actually refraining from stretching. A lot of the time when people have this lateral hip pain, they go into things such as a figure 4 stretch, or they do this cross body stretch, or they do an IT band stretch. And unfortunately, with all of those things, you're putting a little bit more compression on that region. Now, I'm not saying that you can never stretch. However, to help decrease this pain for a short period of time, one of the best things that we say to do is don't stretch. The reason being is, once again, it all has to do with compression on this area. So let's go ahead, get started in the exercise category and what things that you can start to do to help improve the strength of this area and hopefully help get rid of your pain. Getting stronger when dealing with that lateral hip pain is extremely important. The reason being is the muscles that you're about to work on actually help support the hip structure. As we walk, they help keep our pelvis stable and they help prevent us from having extreme compression at the hips with every step we take. Now, there is an appropriate progression when you're dealing with this lateral hip pain. The first thing that we normally start with is something called an isometric. We then move to isotonic exercises, which basically means that we are using the muscle through its entire range. We then recommend, after doing some almost two-legged isotonics or doing more of an isolated isotonic, to doing something more difficult, such as a single leg deadlift, such as a single leg step down, and other things that really challenge you. The reason being is, as I've already said, strength is extremely important when it comes to dealing with this region. And if we don't actually continue to progress in the strengthening category, more than likely the pain is going to remain. And I'm just going to throw it out there. Have you been to physical therapy in the past? Have you done exercises, but you do the same thing for a prolonged period of time with some relief, but it doesn't ever get better? Well, that's where you're lacking in the progression. So let's go through some of these exercises and let's chat it out a bit as to what you should be doing, how many sets and reps you might want to do, and how you can help yourself really get over that hump when it comes to your. So let's get into some exercises to help you with that lateral hip pain. Find yourself a belt or something that really doesn't have any give to it. Go ahead, put this around your legs, and what you're going to do is actually lie on your back on the ground. You are going to go ahead and perform an isometric hip abduction, so push out into that band and then into a bridge. The entire time that you're doing this, you are not letting go of that hip abduction. What you will do is, if you're having a little more difficulty, put your arms on the ground, but go ahead and perform 3 sets of 8 to 10 of this exercise. Next up is side lying isometric hip abduction. Your top leg is positioned slightly behind your knee of your bottom leg, which is bent. You're going to go ahead and push your leg up towards the sky into the band, hold for 6 seconds, and perform 2 sets of 10 of these. All right, so here is a modified side plank. This is great to help strengthen that lateral hip musculature that needs to be worked on with this lateral hip pain. You're gonna go ahead, hold these for about 5 to 6 seconds, perform 10 of them, and I would say perform 2 sets. If it seems a little bit easy, go ahead and perform this with your top leg lifted. Once again, 2 sets of 10, holding for about 5 to 6 seconds each time. Next up is isometric hip abduction at the wall. This is a little more difficult as it is in standing, but what you will do is stand about a foot away from the wall, put your opposite knee up against the wall, and drive both knees away from each other. If you're feeling this in your quad, you have too much of a knee bend and not enough hip hinge, what you're going to do is perform 2 sets of 10 repetitions, holding for about 6 seconds each. Next up are just lateral banded walks. Making sure your steps are small and that your knees not caving in like you see there is extremely important when doing this exercise. Get through 3 to 4 laps of a good distance and your butt should feel fatigued. This is great to work on pelvis stability. Next up is something a little more difficult. This is a standing banded clamshell. What you're gonna do, stand on one leg, really work on your balance, and get in a small hip hinge. Go ahead and rotate your knee away from you. As you see, your back foot will somewhat go behind your opposite leg. Perform this for 3 to 4 sets of 8 to 10 to start and feel it burn. All right, last but not least is a challenge. This is a single leg RDL. It really takes being pretty good at all of the other exercises before you jump into this. You're working on a hip hinge, so pushing your hips back with a nice and flat back while standing and balancing on one leg. What I do recommend here is performing 3 to 4 sets of 8. As you can see here, there's not a lot of rotation at my torso. That is something we're looking to avoid, such as that, or this. The goal is to stay nice and straight. All right, everybody. Well, I hope this gives you a little bit of a better understanding as to how to approach lateral hip pain. Remember, passive modalities such as rest, ice, stretching, and even cortisone may not be your best option. The reason being is that oftentimes this lateral hip pain phenomenon is multi-factorial. It may have to do with a tendon, it may have to do with a muscle, it may have to do with repetitive compression at that area, and it may also have to do with the bursa. So the big thing is just simply make sure that you're getting ahead of the game, making sure that you're doing the right things, and especially progressing your exercises as they should be. Remember, as you exercise with this, keep your pain below a 4 out of 10 at all times. And also, if you have any questions about anything that you heard in today's video, make sure you post them in the comment section below.